All right. Hi, everyone. My name is Eleni. I'm with the Doctoring Duo podcast. Welcome back to the podcast that gives you unfiltered, honest advice and feedback from the average pre-med to the average pre-med, former average pre-med. As a reminder, I do not speak for my institution. I speak only for myself.
Yeah, hey everyone, it's me, the other half of the Doctoring Duo. I'm Noah. And like Eleni said, I also don't speak for my institution. I only speak for myself, and we're excited to get into talking about rotations. And you might notice that both of us look a little more tired and a little bit more sad than you might have seen us previously. So we both started clinical rotations, and we want to talk to you guys about our experiences. So Eleni started out with trial by fire, and so did I somewhat with the rotations that we chose. But I'll let Eleni kind of start out about how like you started out in the hospital, which is a big jump from, we first and second years were normally in the clinic, and then you get thrown in an inpatient setting. So how was that?
Yeah, so by the way, just as a preface, this is a check-in video. We're not really going to get into the nitty-gritty. We're going to make a video on every single individual rotation once we've both been through it. So I think the first one will be family medicine because both of us will have
Yeah.
gone through family medicine first at the same time. Just as a heads up. But yeah, I did start with trial by fire. So I started with internal medicine, and my site was like 25 minutes from my apartment. So I got up extra early. And really, I was kind of just dropped in off the deep end. Like, I showed up like on the first day, and I was like, where do I go? It was interesting because so I was rotating at a Harrisburg site. And so we rotate actually with students from Drexel as well. And that's one of their home sites. And so the Drexel students were at the end of their third year, and me and the other guy who was rotating with us, we were at the beginning of our third year. So very stark difference. They were already acting like interns, and we showed up and we're like, we've never given a presentation before, right? Outside of the practice ones that we did for our OSCEs. Um, so it was like very interesting, the dynamic, because I think attendings were kind of like, what the heck? Why do you not know what's going on? Um, but I think like one thing for me, and I don't know if you experienced this, Noah, was that like I had older students and they were so incredibly helpful. Like I had this one girl, her name was Lydia, and she was so incredibly kind to me. Just like she was the one that was on my team. It was like team A, internal medicine, team B, internal medicine, and we were team B. And like she helped me write notes, she helped me with my presentations, like she helped me like learn the ropes really well. And I will say the residents were also incredibly kind. Like they knew I didn't know anything and they were really willing to help. And so for me, like, yeah, I was really stressed. It was a new environment, it was all new things that was going on, but like I didn't feel as lost by the end of the first week because I had just had such a village of people helping.
Yeah, no, that's great. I think for me, it was it some similarities and some differences. So for me, I started with family medicine. So I was in the clinic, and sounds like unlike you, you had like a whole team of students. It was me, as the only third year, and then I had another student with me on my rotations, which usually isn't the case. Usually you're the only medical student because of how small it is down here at Florida. But I had a fourth year. So it was interesting. He's at the end, or actually, I take that back. He was on his last rotation. So you had somebody at the very beginning, you had somebody at the very end. And like, so that also provides an interesting juxtaposition as like we're going through this rotation. And I'm like, I literally don't know anything about anything. And he has all this experience. But like was super kind, offered to help me do things, and he was wonderful, and all the attendings and residents were great. I think one of the things that is sort of common between you and I's experience is just how helpful residents are, because they're closer to what we're currently going through than a lot of the attendings are. So I think they can sort of relate to what it's like to not know anything on your first day than somebody who's been practicing medicine for 15 years.
Yeah, and you just moved to Jacksonville, right? So
Yeah.
tell us a little bit of that because I'm doing all my rotations. Like my only rotation outside of the Penn State Hershey Medical Center was the one in Harrisburg, which was really only 25 minutes down the road. So like for you, like that was a huge move from Minnesota, right?
Yeah.
I okay, I'm not getting that confused. We are recording this late at night, so in my defense, uh, so oh, my AirPods just died. So can you still hear me?
Yeah, yeah, we can.
Um, it's a big move. It's a big transition from where you did preclinicals to doing clinicals. How's that been for you?
Yeah, I think so not only am I in a different environment because now I'm actually like, being a little mini doctor, I'm also in a new hospital, with new people who I've never met in a completely different state, also away from family. So it was definitely um, a big adjustment. But I'm just so grateful that everybody from the very first day, from the clerkship director to the resident to the attending to other medical students who I've worked with, have just been so incredibly kind and welcoming. And fortunately, down here at the Florida campus, because it's such a small, tight-knit community of medical students, um, some of the upper years have reached out. A lot of the deans of the medical school, from academic affairs to student affairs, have met with me, and everybody's made sure that I felt supported. So it actually hasn't been as lonely as a journey as I thought it would be, which has been nice. But yeah, it was definitely an adjustment because I had left all my classmates who I've gone through everything with, and now I'm like by myself with all the weight on the shoulders. So it was definitely, there were times when I wanted to cry my first week for sure. It was rough, but overall it was good.
I'm glad to hear that you're adjusting well. I know a lot of students have that experience of moving campuses for rotations. I think especially our friends who go to DO schools. My understanding is that's more common. So glad to hear that your experience was so good.
Yeah, for sure. I think one thing that people will probably be interested in, coming, as brand new third year medical students, like how we get adjusted to everything of writing notes to presenting. And we, I mean, I'm assuming it was the same for you, but I've certainly have written a couple of notes before third year, and I know a little bit about Epic, and I've given a presentation or two. But how was it moving to the hospital? You have a real patient. Now it's just, now you're responsible for their care, at least partly responsible for it. So how was that whole experience? And certainly internal medicine where, there's a lot to keep track of with those patients.
Yeah, so I actually fortunately had a few years of scribing experience. I worked as a scribe in the emergency department when I was at UVA. And so I think that gave me a leg up with at least, so Penn State doesn't use Epic, they use something called Cerner, which I have
Okay.
thoughts on, but I won't go into. But my first site was at Harrisburg, which uses Epic. And so I was already super familiar with Epic. Like I could jump in, I could make notes, I knew my dot phrases, like it was very easy for me to jump in. Um, my notes actually, like I've been pretty good with them, fortunately, just because of that experience, but I think my biggest struggle has been presentations. Like
Okay.
I'm not sure about you, but like I really, really struggle to like condense data down into something that's appropriate, especially with like different services. So I'm not sure how it works at Mayo Clinic, but at Penn State, like I went on internal medicine A, which is just like general inpatient internal medicine for 4 weeks. And then I moved to consult service, which was infectious disease. And like infectious disease presentations versus even inpatient IM rotations were like a night and day. Like ID wants every detail. Like they love it when you ask, for example, like, have you like been around farm animals, like it was working up like a liver cyst, things like that that, really don't matter as much for like a general internal medicine one. But even with general internal medicine, like they want specific lab values and they want to hear the specific lab values and the trends and they want to hear the history every single time, even if you've presented this patient, 5, 6 times. And I think like going between internal medicine and surgery was a big like shell shock for me because like I went on surgery and the intern that was like mentoring us was like, no, 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 you have way too much detail. Like you don't even need to say the name of the patient again. Like we know who the patient is, it's on the list, right? Just say post-op day, whatever. And you don't need to say history. And all you need is eyes, nose, and know the lab values, but you don't need to say them. And so I think for me, adjusting for what each service wants is a really big challenge. But I think the best way to kind of work around that is to like ask those you're working with, especially if like there's a cool intern or resident, like, hey, like what are your expectations? Or like, hey, can you listen to my presentation before I give one? Just so you can kind of get that feedback and figure out how that service works.
Yeah, I'm definitely with you. I think even though I didn't have the scribing experience, I think writing notes and taking a whole lot of patient data. And for me, I'm a little bit better at writing than I am at speaking at times. So I think for me, taking a whole large sum of data and writing a condensed note with a nice assessment plan actually came a little bit more naturally than, like you said, presentations. While I didn't start out on internal medicine, with family medicine, I think the struggle with presentations is just how broad everything is. And it's sort of similar to like a general internal medicine service. I could get one patient who has right shoulder pain. Then the next moment, I have a girl with pelvic pain. Then I have an old man who has uncontrolled hypertension and diabetes. And each of those are just totally separate in both lab values or the lack thereof, physical exam findings. How do I present this in a condensed story if they have pre-existing medical history? So I think that was also a struggle. And then also coming up with your own assessment and plan. Like before, a lot of it, our role has been as data collectors, getting the HPI, doing the physical exam. Like, what are your findings? And we don't necessarily have to interpret that and come up to what we think it is and what we want to do about it. So that was a real struggle. But I think one of the things that helped me, one of the attendings into residence, is that one of the things that they really helped me drill down is create a one-liner. Like, what is your summary of what the patient here? What's your problem representation? And that's sort of what helped me as I've gone through subsequent rotations, have helped me refine my presentations more and more.
Yeah, no, I think that's a great tip. Absolutely. But yeah, I think transitioning between rotations, this is a terrible transition. But talking about transitioning between rotations, you know what, one thing that I did wasn't prepared for with surgery was how much back pain I was gonna have. Um,
That's true.
I'm on surgical oncology service, and it's amazing. Like I'm seeing things that I don't think I'll ever see again. Right. Like when am I, unless I personally do surgical oncology, like when am I really ever going to see like a Whipple, or when am I ever going to see an open pancreatic resection or like a cytoreduction of tumor? When am I ever really going to see that in this context? But gosh, the surgeries are so long. I was not ready. Like I am 24 and I'm wearing a back brace and Gus and like praying for my life because my back hurts so bad. So like I guess what was your biggest surprise like transitioning, because like you made some big jumps. You went from peds to OB, like you've had some different unique experiences. So I guess what was your big like small thing that surprised?
Yeah, I think my big small thing, I think a couple since I've like jumped between two different rotations. I think one of the things was definitely transitioning between an outpatient and an inpatient perspective.
Yeah.
The cultures are so very different. It's very different going from 12 patients back to back to back than having 12 patients on a service and keeping track of all of them. Or in my case, like three or four. I think and juggling, keeping all those stories and like following up on a lab value. I'm so used to, from an outpatient perspective, sending a lab and then you see them back in 2 weeks. That's not the case in the hospital. You follow up on those labs in 2 hours and not 2 weeks. I think the other thing that was also just a completely different, like my big small thing, was the OR. And the OR is again a completely different environment. So now I'm on gynecology. So I had 2 days of my week I was in the OR. So a lot versus you, a lot of standing surgeries. For us, it's a lot of laparoscopic robotics. You can most of the time you can sit during those surgeries. And they're like maybe like the longest is like 4 or 5 hours. But again, just the I'm sorry, Eleni's like, I hate you right now. After I sat through, she's like, after I sat through my 11th cholecystectomy, I've had like enough. So but I think again, just like the culture difference of like the sterile environment. When can you speak? How do you be helpful in an OR when nobody knows who you are or particularly cares about you? I think it's just all things that, it, and I talk this a lot about medical students in the pre-meds. It's sort of like the hidden curriculum of the OR that nobody bothers to tell you, but everybody expects you to know. So I think that was the hardest part.
Yeah, oh man. I there was like a bunch of hidden med student duties that I didn't know about. Like I knew that we were supposed to like assist with putting in like Foley catheters and stuff like that. Like the course structure's very upfront about that. But, like I didn't know that you were supposed to like come in and shave the patient, like shave like the surgical area. Like that was your job. And the chief was not super happy when she had to tell me to do that. And I think like kind of building off of that, like having a good attitude about it. Like I think especially in surgery, like they don't want to hear apologies. Like they don't want to hear like, "Oh, I'm sorry, I'm sorry." Like they want to see you like respond with actions. Like if someone says something to you, say, "Okay," and then next time make sure you do it. And I think that like learning the culture of each service is very different. And from what I've heard about family medicine, it's like a very warm, like homely type culture with like lots of hugs and cookies and listening to Taylor Swift in the workroom. That's what I've heard about it. Internal medicine was very much more, I think, serious and instructional, but like also caring. And I think surgery is very much like we want to see you like put that first foot forward. Like we want to see you be brave and take that first step without necessarily have to ask first. And so I think that like learning the culture is super, super, super important to any rotation. But that takes time, right? And that takes practice.
Yeah, it takes time and practice. And I think one tip that I'm just now picking up on is really like personality mirroring. If you're with an attending who's like bubbly and like loves to talk and be around, like I had in family medicine, like I worked with one attending, Dr. Grimard, he was absolutely wonderful. Like we just talked and it was great. The attending during my 5 hour gyne surgery who just wants me to retract, my mouth was shut that entire case. Like, it's just one of those things. And you don't really learn to pick up on that unless you're an observant person. So I think one of the things, and maybe you get slack for it the first day, but I would encourage everybody, especially in the OR, to just maybe watch the first day and like, or stand back is what I mean. And like just observe, how do the teams interact? What are the steps? Like, what do they do to move the patient? What do they do when they're prepping the site? When can you go get the bed? And just those things that you just take a mental note of, so like you can at least offer to help, is super useful. And then of course knowing when to talk or when to ask questions is a big one. When somebody nicks an artery and they got to stop bleeding is not the time to ask about whatever anatomy question or clinical question that you had. You do that after the patient has been stabilized. Or for family medicine, if you see an attending busy answering a bunch of inbox messages, again, might want to wait until you have some time. So I think that comes with time and it comes with experience and knowing your team. Um, but you can easily pick up on those things if you just pay a little bit of extra attention.
Oh yeah, I think that's a great point. I think that's a great point to wrap up on as well, is that, I think I mean, obviously we've not been on rotations very long, right? And so this is just kind of our check-in, but I think that the biggest takeaway I've had is pay attention. Pay attention. Because as much as you're watching them, they're watching you. And so if you show that you're engaged and you show that you're caring, even if you mess up, even if you don't do something right or you say the wrong answer, or you don't know, like if you show up and you show that you care and that you're listening and that you're trying, I think that's what matters the most. And in my experience, I don't know. Any other closing thoughts, Noah?
No, I think that's a perfect way to end, is just pay attention, show that you care, work hard, and everything ends. Even surgery ends. It'll be okay.
Yeah, when you said laparoscopic surgery, my back still hurts. From a 14-hour laparoscopic Whipple that we were in. So, yeah, I wish it was cholecystectomies. But anyway, that being said, I think this is a great little check-in for us, and we'll be back next episode. I'm thinking we'll probably have an episode in June and either June, July, and then the next big episode will be our family medicine one. Because I don't finish family medicine until August end of
Okay.
August. So, all right. Well, thanks, guys. We appreciate you guys tuning in as always. Feel free to drop questions in the comments. And if you like what we do and you want to support us, give us a like, comment, subscribe on whatever platform you may be of your choosing.
All right. See you guys. Have a good one.